Nephropathy, or kidney disease, is a condition that occurs when the blood vessels that are responsible for cleaning or filtering the blood within the kidney becomes damaged. This damage can be caused by hyperglycemia that's gone uncontrolled for a prolonged period of time. It can also be caused by hypertension, smoking, high cholesterol levels, or a family history of the complication. Damage within the kidneys can lead to a second condition involving the part of the kidney called the glomerulus. And what happens is this part of the kidney becomes more permeable to albumin. And this condition is called microalbuminuria, leading to an increased level of albumin in the urine. Signs and symptoms of nephropathy include uncontrolled blood pressure, edema within the distal extremities or the eyes, an increased need to urinate, shortness of breath, nausea and vomiting, confusion or the inability to concentrate well, a loss of appetite, protein in the urine, the reduced need to use the individual's insulin or to administer other medications tied into the control of their diabetes, and a persistent itching sensation. Beyond that, microalbuminuria can be indicated by a foamy consistency of the individual's urine, again, protein in the urine, or their skin appears or feels to them as if it is puffy. It should be noted that while some of these signs and symptoms seem pretty obvious, kidney disease can, in some cases, be quite progressed before an individual may notice these indicators that something is wrong within their body. In terms of exercise with these conditions, the participation within both aerobic and resistance exercise programs have shown to be strongly beneficial in that it not only improves the individual's physical functionality of dealing with this disease, but it also greatly improves their quality of life. And then touching a little bit more heavily on the resistance exercise modality, this type of exercise has been found to not only improve their muscular function, but it also strengthens their ability to perform activities of daily living on a more independent level. Since both of these conditions are pretty significant and tied into diabetes, most patients should undergo some steps through some standardized pre-screening before they begin an exercise program, just to rule out any additional concerns and to make sure that it's safe for them to begin a regimen. If they are cleared to exercise, then it's recommended that they begin at both a low intensity and low volume. And then a second recommendation is that they should avoid movements that don't involve high intensity or any breath holding to prevent significant increases in blood pressure. Because of this, and because a lot of these patients are deconditioned or greatly lack experience in exercising, they should definitely be supervised. This not only prevents an adverse event from occurring, but it will also benefit them and hopefully help them with adherence to whatever program that they have chosen to pursue and have been prescribed.